My name's Alistair McLaughlin. Nice to be with you this afternoon for the Polish Fascia Symposium. And I do appreciate the organisers for inviting me along to make this brief 30-minute presentation, mainly centred around scar tissue and its effects in the body. Now, I was here last year, made a presentation which was available to view on the Fascia Symposium video library. If that's still available, you can look that up again. I don't want to necessarily repeat a lot of what I talked about last year, but if you weren't here last year, then I'll recap some of the points that I feel are of main interest to you as a body worker. But just before that, one thing I want to mention that's happened in the last 12 months since I spoke to you is that we do a lot of education around scar tissue and the treatment of scar tissue, myself and a team of instructors around the world. One thing that comes out quite clearly to many of the students that I speak with, those students who are learning scar tissue techniques, is that in their former training as a massage therapist, as a physiotherapist, osteopath, whatever it happens to be, that their knowledge of scar tissue is very limited in terms of how scars are formed, how scars affect the physiology of the body, how scars affect the biomechanics of the body, and also the psychology of the patient as well. And so I find that quite amazing that such a common disorder of the body, scars formed by trauma or surgical intervention, quite amazing that this very common phenomena of scar tissue and fibrous tissue, that isn't taught very much in our schools, in our education program. And even the greater challenge, I believe, is therefore what to do with scar tissue when it presents. And I think that's a large missing area of our education. And so part of my role, if you like, is to help to change that, to inform practitioners more about the effects of scar tissue. And they're very wide and diverse, make no mistake. So I believe this is an important topic. And it's not just an important topic, it's a very important topic that we need to start looking at in greater detail. What it does, how it affects the patient, and what we can do about it. So I'd like to just recap some of those areas that I discussed last year in the symposium, not spending too much detail in it, because I want to go on to how scar tissue affects people personally. You know, we're in bodywork, or I'm in bodywork, certainly to help our patients as much as we possibly can. And if we are not looking at scar tissue as being a real driving force that can inhibit progress in your treatment program, then we're missing a big part of that therapeutic puzzle. So let's just do a little bit of recapping about scar tissue. And one graphic that I like to display to students is this, that exemplifies, you know, what is scar tissue, and this illustration is about how healthy tissue, the collagen fibers are very much organized structures, but when scar tissue forms, it's a very random and haphazard process. Whereby the body seeks to repair itself as quickly as possible. Scar tissue formation starting as early as a week after tissue injury. But we get this very disorganized arrangement of collagen filaments that form from the extracellular matrix. And as a result of that, we have a very compacted and a very tightly bound arrangement of collagen fibers. And this in turn leads to a reduction in vascularity in the tissue. So you're going to have a look at internal scar tissue being very white in color, and even surface scars can appear very pale and white in coloration due to this restricted blood flow through the tissue. The other thing that scar tissue does is it impedes the flow of lymph fluid, and lymph fluid, an extremely important component of mobilizing toxicity out of the tissue area. So what we have is an unhealthy area of tissue where blood flow is minimized and lymph flow is impeded. Both those things don't make for a healthy tissue environment. And inflammation can persist for a long time in that area because of those two things. Toxicity is trapped in the tissue. It becomes devoid of oxygen and nutrients. That is not a healthy tissue environment. And so it's really important that we can make scar tissue as healthy as possible. And so we have to think, what else does scar tissue do apart from that localized effect in the scar itself? And of course, as people interested in fascia, which is why you're at this symposium, this graphic is, again, speaks volumes as to how the interconnectedness of fascia through the body and its ability to glide and move that can be severely impeded by the formation of scar tissue or fibrous tissue. Fibrous tissue extends and continues to develop. If you have a client that's had limited shoulder movement for some weeks or months, it's already developed further fibrous tissue around the joint because of its limited movement. The shoulder needs to work in all its planes of movement to keep it functional and free of the buildup of fibrous tissue. But through limited movement, we get this buildup of fibrous tissue. The illustration here shows that the fascia in one part of the body that's affected by the scar can severely impede the functionality of another body part remote from the site of the scar. And from this next graphic, it's not difficult to see how scar tissue in the thoracolumbar fascia or the superficial backline fascia would impede the rotational movement of this golfer, for example. And with medium to long-term shoulder restriction, there's going to be a buildup of fibrous tissue in and around that shoulder area at various points, depending on the type of restriction being presented. Now I'd just like to share with you some of the research material about scar tissue and the effects in biomechanics. I like to refer to this research by Carol Lewitz and Sarka Olsanska from 2004. And in their conclusion of their research, and this is a very important point if you're a bodywork practitioner, and I really want you to take note of this conclusion of their research. Untreated active scars are an important cause of therapeutic failure. Treatment also widens the scope of manipulative therapy. So what Lewitt and Olsanska were saying here is that if scars are left untreated, it could be an important cause or reason of therapeutic failure. In other words, your treatment outcomes either do not last as long or they're not as efficient as they could be. The outcome of your treatment may not be as effective as you would have liked. The next article I'd like to draw your attention to is from an NCBI resource website. In this research document, Biomechanics of Scar Tissue and Uninjured Skin by David Core and David Hart, it was noted that compared with uninjured skin, scar tissue demonstrates similar high load stiffness, greatly reduced resistance to failure, reduced low load compliance, and altered material directionality. In other words, compared to uninjured tissue, scar tissue is a weaker structure, Maximum tensile strength of scar tissue reaches about 80% of healthy tissue, and often it's even less than 80% of tensile strength. So it's a weaker structure, it's not as pliable, and therefore re-injury of that tissue area can happen because it doesn't stretch, it doesn't give, it doesn't move in the same manner as healthy tissue. And all that's really important if you're working with sports people that need high levels of functionality to achieve optimum performance. Further down in their research document, it's stating that acute wounding alters the skin's fibrotic structure, thereby producing scar tissue with significant functional impairments. Exploring skin biomechanics in both healthy skin and scars provides insight into the directionality of healthy tissue and how it changes with injury. And we've demonstrated this with this little video here that shows that scar tissue impairs the directionality of the gliding mechanisms associated with skin and the underlying membranes of tissue. Just take a look at this little video that we did. So in this following example, we're going to look to see if the scar is considered active, which means that the surrounding tissue doesn't move very well. Here's a knee scar from reconstruction surgery from a skiing accident in 1996, and you can see quite clearly the scar. We're going to gently palpate the tissue for restriction in movement. All seems okay from proximal to distal, but when we palpate across the scar, you can see quite clearly how the tissue here is restricted in movement. It's not moving well. So this will be considered an active scar when you can see the tissue pulling in that area. But in order to determine and help us find an area of distressed tissue, we can use a well-known technique, stroking a dry finger across the area, because tissue, when it's distressed, it perspires, it's wet. So if we drag our dry finger across that tissue distressed area, it will stick. It will stick on the tissue where the tissue is distressed, and we just simply do that with a dry finger, stroking down that area, and we can see that it matches exactly with the area of the loss of feeling by the client and where there is tissue restriction. So that's just a nice little example of assessing for an active scar. And then the next thing we want to draw your attention to is this article from Science Direct, the torsional upper cross syndrome, in relation to scar tissue and how that affects upper cross syndrome. Upper cross syndrome describes muscle imbalances of key antagonists causing forward postures of the head and shoulders and associated changes in spinal curves, particularly an increased thoracic kyphosis, as well as changed function in the shoulder girdle. But let's just go down to the relevance of scar tissue with this particular presentation. The article goes back to the research of Lewitt and Olsanska in 2004, when they researched on 51 patients, and they found that they defined active scar tissue as a scar that doesn't allow for the subsequent layers of tissue to move independently of each other, which is what our little video showed you just a moment ago. But they also further defined active scar tissue to include proprioceptive changes that causes faulty efferent output, so impaired neural feedback, which can then critically compromise postural and normal kinetic chain activity. Lewitt and Olsanska also noted that diagnosing these disorders the effects of scar tissue on biomechanics can be challenging because the site of lesion and symptomatic region may be very distant. In other words, the site of the scar may present small symptoms to the client, and this is why often patients will say, the scar doesn't bother me much. But what Lewitt and Olsansker were describing is an effect distant to the site of tissue injury and scar tissue, and you have to go looking for it. And going back to the text, it says, because the lesion site can be distant to the region of pain or other symptoms, a thorough examination, often to an asymptomatic region, is warranted in order to establish a correct diagnosis. But in reality, how often do we do that? How often do you go looking for scar tissue, for fibrous tissue that may be a major factor in the presenting problem, but it's nowhere near the site of symptom? And that's a challenge. And that's why I think this is not important. It is very important. It is vital to the outcome of your clinical work. So I'm on a bit of a mission to alert practitioners and really to fill this gap in our education that says we didn't really take into consideration scar tissue as being a factor in all these kinds of presentations that walk through our door. How we address that is an even more important question. Well, we do that by changing the orientation and changing the configuration of those very tightly bound collagen filaments. See, there is a school of thought that's been around for many, many decades that scar tissue in some ways broken down or broken up. That's the other verbiage that people use. Scar tissue is a very tough, fibrous material that will even blunt the scalpel of the surgeon. But let's go back to talking about the people we treat, the patients. How does it affect those people? Because that's what we're here to do. We're here to help people. But we can only do that if we're aware that scar tissue is potentially a player in the problem. And in my experience of speaking with many, many people after surgery, wound care and scar tissue care is pretty damn poor around the world. And it's only if that scarring is perceived by their surgeon or doctor at a later stage that it actually creates huge problems for them is anything actually done. And the reality is we have millions of people walking around the planet with the effects of scar tissue, creating pain, biomechanical dysfunction, back pain, shoulder restriction, and much, much worse than that. So you have to realize that this actually should be addressed early on, post-operatively, because it's very common. A person says to their doctor, oh, I had this cesarean section, for example, I can't feel that, or I had this lower leg surgery and I can't feel it. I can't feel that area anymore. And it's very common for the doctor to say, well, you might get the feeling back in the next 12 to 18 months, but if you don't get the feeling back, then that's how it will remain for the rest of your life. And it's just not true. I'm sorry, it's just not true. This is not a true statement. And we've demonstrated many, many times that we can change even long-term scarring very, very quickly by reorganizing, by reconfiguring, and remodeling those tightly bound collagen fibers that are just adhered, they're limiting movement, and we can do something about it. And one of the effects of a trauma injury or an emergency surgery, for example, that results in scar tissue, and this is not spoken about very much at all. It's the psychological and emotional effects that that scar produces. So when we're talking about scars from trauma or injury or emergency surgery, for example, that scar on the body represents the event and everything that happened around it at the time. Now, trauma, you go into the definition of what a trauma is, and not everybody is traumatized by the same kind of event. It really depends how they process that. And if the event overwhelms them mentally, then it anchors in there and it stays there. Other people with the same kind of event, they deal with that. They have a completely different outlook on that event, and they see it as a positive thing rather than as a negative thing. And so some of the kinds of surgeries that can, with some frequency, result in negative emotional states are things like emergency or even planned cesarean sections, hysterectomies, mastectomies, and amputations as well. Losing a body part through amputation can be a huge trauma. But for other people, it was a life-saving surgery. So it really depends on that patient's mental outlook to that surgery itself. We also have things like, scars from knife wounds, bullet wounds, um, and also associated very much along the lines of post-traumatic stress disorder. And I do think there is a strong correlation between the physical scar and what it represents and the mental emotional state as well. And so how do these things manifest? Well, it could be that the scar and how people feel about that brings on low self-esteem, loathing of themselves. They don't like looking at the scar. They don't like to touch their scar. They don't want other people looking at the scar or touching it. Um, it may interfere with relationships. We know that some forms of scarring from cesarean sections, hysterectomies, actually cause physical pain on intercourse. So it can interfere with relationships and marriages and partnerships as well. Um, it can also lead on to anxiety and fear and depression, and it can certainly be a downward spiral in terms of how people view the scars. People with scarring from self-harm, you know, they feel ashamed of what they did, and they seek to cover up those scars from self-harm. Another common one is the body feeling disconnected in some way. That a scar, especially on the extremity, uh, makes some people feel as if that body part doesn't belong to them. And they actively, demonstrate that by that gesture. When you talk about that, how do you feel about your scar? They do this gesture of disconnection. It's and also reasonably common with some women with cesarean section scars to feel as if their body is disconnected. And who do you tell that to? As a woman feeling that way, who do you tell that to? Do you tell it to your doctor? Would he understand? What would he do about it even if you did? And these are really personal and deep things. So how might scars affect people? Let's give you an example of this psychological effect on one client from Australia. She attended the clinic of one of our practitioners doing this scar work, and the practitioner observed a scar on her upper back. Now, the patient presented because of stiffness in the neck and shoulder area, but the practitioner saw this scar. How did she get a scar there? What's the story? And there's always a story behind the scar. If, for example, you people watching this presentation, have you got a scar? If you have, how did you get it? Do you remember? I bet you do remember. I bet you remember everything about it. what happened, who was there, and so on, when it happened. Um, and when you think about that, how does that affect you? Does it create an emotional response in you? The emotional response in this patient we're talking about, the upper back scar, which is about 4 centimeters long, was actually a knife wound. This woman's sister literally stabbed her in the back with a knife when they were teenagers, and this patient is now in her 50s. So for many years, this scar was there, and you can well believe that these two sisters really didn't get along. Um, but the amazing thing that happened is that after a couple of treatments of the scar, it became beautifully soft and supple again. It helped to address the neck and shoulder issues. But then there was a transformation. There was a movement, a mental shift for this client who had never got along with her sister since that incident. But she opened up to the practitioner and said, you know what? I've decided to call my sister. It's about time we put the past behind us and moved forward. So for all these years, she'd harbored resentment towards her sister, justifiably so, I reckon. Putting a knife in someone's back literally is not a sign of sibling love, you might say. But once the scar had normalized, once the person felt that she'd reintegrated with the scar, there was also a mental shift for her as well, which prompted her to want to call her sister and put things right between them. So that's just one example of many that we could tell you. I was listening to a Pink Floyd album the other day. It's Dark Side of the Moon, probably one of their most popular. And there's a lyric in there that says, you know, carry on in quiet desperation is the English way. Don't know if you know that, but carrying on in quiet desperation, it's the English way. We don't complain, but people all over the world suffer with their scars and the effects of their scars mentally, psychologically, and physically because they don't think anything can be done about it. And I'm here to tell you that you can do something about that, but only if you're aware that that is a real thing that is happening to people. So I'm here to tell you in, as stronger terms as I can, that if you're not aware of this problem, how are you going to even look for it? And if you find it, what are you going to do about it? And that's what I'm here for. My role, I believe, is to help you to help people with scar tissue. And it's a very important thing that you shouldn't ignore. You should look into it in more detail. Knowing how to address scar tissue will completely change how you work with people. The treatment of scar tissue does become a priority in your treatment program rather than totally ignoring it or relegating it to further back in the treatment program. Scar tissue becomes a priority for you and for your clients. So thank you for listening. Thank you for the opportunity to speak today, and I look forward to your questions coming up. Thanks.